Welcome to the Journey to Wellness podcast, sponsored by the Essential Wellness Society and Healing Wheel Holistic. I'm Melissa Stonehill-Kyam, and I will be your host. With over 40 years' experience in the health and fitness industry, I am ready to dive in to some of the most conflicting topics we have regards to health today. Let's go. Thank you for joining us today. And I'm going to say one word, and I hope it gets you excited. Hormones. We haven't covered that yet. And actually, until just a few minutes ago, I didn't really know that we were going to be covering it. But I am sitting with the herb doc, and that's Tiffani Huckels. And I am going to have her tell you a little bit about herself.
I'm a pharmacist and an herbalist. I actually went to pharmacy school to study plant chemistry and then wound up teaching it before I graduated. I lived in Minnesota for 12 years and worked at the Mayo Clinic, where I did most of my rotations. I also worked in an alternative medicine clinic in North St. Paul, as well as teaching at the university and working at the Mayo Clinic. When I moved back to Colorado to be closer to family, I wound up being the hormone queen over at College Pharmacy, doing all the hormone consults. So that's kind of how I got into hormones.
So I'll tell you why this excites me. Okay. First of all, if you're not excited, you need to get excited, because it doesn't really matter what age you are. I've seen young men bottom out with, really low testosterone levels coming out of college from all the stress. And yeah, you can bounce back a lot easier when you're younger, it seems, because the body wants to produce more. But menopause and andropause is a thing. And men don't talk about it at all.
That is true.
And it's something I really feel we need to educate men with, that you also have a turn of events in your life where your body goes through transitions and changes. And you can talk about, some of the things that you see, what it looks like.
Yeah. Well, how I got into doing hormones was I was working at the Mayo Clinic, and my husband and I at the time were trying to get pregnant with our first child. And we'd been trying for well over a year. And so I went to my doc and I said, hey, can you run my hormones so we can fix them so that I can, have children? And he just looked at me and told me, well, I could run them, but I wouldn't know how to read them. But I can give you an antidepressant if you'd like. So I actually wound up going all the way to the research department at Mayo to find a doc that was working with bioidentical hormones. And her and I worked together on my hormones, and then I actually wound up working with her when the Women's Health Initiative came out, and a lot of the doctors didn't know what to do with women that were on things like Premarin, and so they needed help in guiding them with the bioidentical hormones. Otherwise, they were just taking women straight off of hormones, and that was a nightmare.
I think we need to jump in a little bit. I know what bioidenticals are, but I think a lot of people don't know what they are. So can you explain what bioidenticals are?
Sure. Bioidentical hormones are basically hormones that mimic the hormones of your body. Most of them do come from plants, and basically they just work with the body chemistry. It's what your body is used to. Therefore, they seem to work a lot better for most people that I've found.
Yeah, and there's, from what I understand as well, and correct me if I'm wrong, my husband does work in oncology, and he was telling me when I did experience menopausal symptoms, he was telling me that there's a lot of high risk involved in the straight up medical hormones that are not bioidentical, and that they found there was lower cancer risk to bioidenticals, and in fact also with men and heart health, that if men are low T, it gives them a higher risk for heart issues. Is all that correct?
That is correct. The thing is with your hormones, there's 3 different kinds of estrogen. I call them the good, the bad, and the ugly. You've got estrone, which is the ugly. You've got estradiol, which is the bad, and then you have estriol, which is the good. Estriol is actually heart protective. It actually also protects your bones. It also can be all right for certain cancer patients to be able to take it, as long as they're working with their doctor and you see what receptor positive they are.
Right.
Progesterone works to calm the body. Even men need progesterone to actually help with inflammation, particularly in their prostates, as well as in their arteries. So it's a chemical balance, a chemical dance that needs to go on. And the more biologically similar to what your body was when you were younger, the better things go with your hormones.
Now, can you talk a little bit also about DHEA and
Sure.
how that plays into this whole symphony of hormones?
Sure. DHEA is basically one of your pre-hormones. Therefore, it'll actually turn into estrogen and testosterone. Therefore, it's needed to be in balance, just like pregnenolone, which comes straight from your cholesterol. That then turns into progesterone, then androstenedione, then testosterone and estrogen. So you definitely need it more in balance. A lot of doctors aren't necessarily using DHEA or pregnenolone because they're further upstream in the body. They come straight from cholesterol. Whereas the docs like to be able to measure things more definitively. DHEA is very easy to measure in the blood or in saliva. Different docs like to measure it different ways. I like to also look at the urine metabolites of your hormones to see how your body's using the hormones. And so there's lots of different ways to look at how those are.
Yeah, so when you were talking about that, I know that when I've done a cortisol saliva test, that it's usually cortisol and DHEA that
Yes.
they're looking at together. And the way it was explained to me is that DHEA, if you had a family tree, is like you're the grandfather, and then you have your testosterone and your estrogen, and then all the other players.
Yes.
And that if the DHEA is low, and they're just trying to boost up T, for instance, there's all these places where testosterone institutes or whatever. And I'm probably saying the name wrong, which is great. But if you're just trying to boost up this one thing, you're going to hit a ceiling here.
Yes. Well, and you can cause problems because they won't necessarily be in balance with all of your other hormones. A lot of people lately have been turning to pellets. And pellets for hormones are all right, except for the fact that as soon as the pellet gets inserted, you're going to have a spike of that hormone. And it's going to take a while for that to then go down. The problem with pellets is you do have that spike, and then it drops from there. You don't have a nice steady level necessarily, which is why I'm not a big fan of hormone
But the
pellets.
other thing, too, is that if, let's say, you needed to tweak estrogen or you needed to tweak progesterone, and there's pellets, you don't have the ability to tweak it. So I would say that my comfort level would be to have them all compounded separately so that I would know like what's working and what doses.
Yes.
But, part of why I'm so excited is that you got to be really good at this. And, I'm looking at your diagrams and everything, which would be so much fun to talk about. This is an art. And I know from personal experience that when I was in California and I was, put on some bioidenticals, there was an amazing pharmacy that my provider worked with, and I felt really good. Within 2 weeks, I felt different. Yeah. And then when I moved to Colorado, I haven't been able to replicate that feeling. And it's one thing, like I can get all the right labs and actually have a provider that can read the labs. I can read the labs.
Yeah.
But the pharmacist is like the major player here, because from what I've experienced is the doctor and the pharmacist work together to start to get the right blend, and you're more in touch with the pharmacist. How's that? How you feeling?
Well, and it also depends on what base the pharmacy is using for your hormones. Different bases, some bases will help you avoid the liver so that it avoids what's called the first pass effect, so that it's not affecting, or basically it's not causing congestion in your liver.
Okay.
And it's not going through the breakdown products as bad by not going through the liver. Estrogens in particular, when they go through the liver, that's when you get the good, the bad, and the ugly. And usually as you get older, you have to detoxify those bad estrogen metabolites. That's where things like your cruciferous vegetables come in. Broccoli, cauliflower, Brussels sprouts. You can also take a supplement of DIM, which is basically from cruciferous vegetables to help you detoxify those estrogen metabolites.
So I love that you said this, because as a nutritionist, when people come to me, one of the first things I do is put them on a liver detox, because the hormones clear through the liver. And I found that if the liver's congested, and, let me qualify that too, because you say, well, why would the liver be congested? I don't have bad habits, or, I take good care of myself. But the thing is, if you have to understand the filtration systems of the body. You're breathing the air. Things are gassing out. There's light energy. There's more than just what you consume that kind of build up in the body. There's over-the-counter medications. Maybe you have allergies and you're taking certain medications over the counter. This all is going through the liver. So it's really, my recommendation to my clients is to go on a liver detox like quarterly.
Yes.
I could pick like winter solstice, summer solstice, things like that.
It's always good. I always like to go with phases of the seasons or the moon, for sure.
But I like that you brought this out, because even if you get on board, and let's say someone gets labs done and then they get on a great protocol, but they haven't dialed in their nutrition. Yeah. So they're working against themselves in that way.
For sure.
And I love that you mentioned the cruciferous vegetables. Yeah. Most men that are supplementing testosterone will also be taking DIM. Hopefully. Yeah. And I want to talk a little bit more about andropause, guys out there. Yeah. I want you to hear this, because these are things people don't tell you. And there's certain things like lost enjoyment of life. When a man's sexual drive goes down, that's a symptom, because it's not really standard operating procedure for a man.
No, it's not.
Yeah. So let's talk a little bit about andropause and, kind of get you guys out there on board.
Well, there's a lot of things that can play into andropause. They could be having issues with their prostate, issues with urination, and there's different supplements that can help with that. Believe it or not, there's actually a flower pollen extract that works great on helping men be able to pee better. There's different plant extracts that also help with the prostate. And one thing I really recommend if a man goes on hormones for andropause is that they also look not only at the testosterone, but at the DHEA and the progesterone. Men need progesterone. Progesterone helps to decrease inflammation in the prostate. So it can definitely be vital to keeping that prostate happy. The other thing that's actually vital for the prostate is lycopene from tomatoes. I have different patients, I have them take a tablespoon of either pumpkin puree or tomato paste puree daily, just to make sure that they're getting that in their diet.
It's also really great for your eyes.
Yes.
I'm doing a lycopene supplement now for it. I don't know if this is well known, but there's a lot of research out there that it helps with blue light
Yes.
for the eyes. And I'm really happy about it. I did some research on there, and I was like, wow, I love when we get things from plants. And when my
Definitely.
chuckle when you said that there was a flower pollen that helps with urination, what the chuckle for me was just like, how simple is that?
Yeah.
Like, why would we think that we can't find things in nature?
Right. Well, and I mean, 70% of our drugs used to come from plants. Now it's only about 20%. But saw palmetto was actually used as the plant base for the latest drug to help with the prostate. So
let's talk about levels for a minute, because unfortunately, insurance companies won't pay for hormone replacement therapy for men unless their T levels are below 300.
Yeah.
Now, if you're a guy and your T levels are below 300, you are knuckle dragging. You feel like garbage. And it kind of bothers me that this is a number that they're looking at.
Yeah.
So what is an optimal number?
Well, it's not so much the number as it is the symptoms.
Okay.
Because like I give my husband testosterone weekly, along with his DHEA and his prostate support supplement. And it's a matter of how does he feel? How is his energy? How is his sex drive? Is he getting too angry too fast at work? Is he grumpy at home? Or is he, like you said, dragging through the day? Your cells have receptors for 4 things: adrenal hormone, thyroid hormone, vitamin D, and light. Therefore, you definitely have to balance the adrenals and the thyroid first before you look at the other hormones. And I've found a lot of guys that are in adrenal fatigue, and therefore they're not getting the stimulation for the cells from the adrenals anymore. And that can also lead to a low T level because things aren't working. And
I think it's
right.
brilliant that included in that was light.
Yes.
That the cells have receptors for light, and we're talking sunlight, aren't we?
We're talking sunlight, but we're also talking about full spectrum light, because there's a thing called color puncture that you can use to actually stimulate different pathways in the body.
Wow.
So, yeah.
This is just amazing. You're such a wealth of information. And another thing that I noticed is many men who are put on testosterone therapy, let's say they go in and their T levels are at 300, and then they get injectable testosterone and the T levels go up to 500, okay?
Right.
But then let's say they go off of it for even miss a couple of weeks off the cycle. I've seen that now drop lower than 100.
Yes.
After that.
Because the body was expecting it. Plus, then it also, because they're getting testosterone injections, depending on their body fat, their body can actually turn that testosterone into estrogen.
Right.
I always recommend that a guy is taking a supplement with some chrysin in there, or they get the chrysin added to their hormone replacement as a way to try and prevent that conversion of testosterone to estrogen.
And chrysin is an herb?
Chrysin is a natural substance that they've used basically to inhibit the enzyme that converts the testosterone to estrogen.
Wow. This is all amazing stuff. All right. Now, we're going to give some equal time to the ladies out there. Very, very, very different with women. I've met women who have hormonal imbalances due to PCOS. I have met women with hormone imbalances due to athleticism, military life, multi-vaccinated people, like when you're over-vaxxed in some of our armed forces. I've met ladies who stress has caused imbalances, birth control pills, oh, geez, there's such a laundry list.
There's lots of things
You know,
that can affect the hormone levels in the body.
Right. And not
So,
just natural events. Like,
No.
we know that there comes a time in life where women do go through a premenopausal, menopausal, perimenopausal. I will tell you my own feeling. I don't think there's a perimenopausal, because I feel like you're always in it and it's always changing. And I'm still not at the point in my life where I can look back and go, yeah, I remember when I was going through that, because I'm still going through it. So it's a little bit difficult with women.
Yes.
A little bit more fine-tuning.
Well, and as our environment has changed and gotten more estrogens, more plastics, and things like that in the environment, that has also changed the chemistry of our bodies. I've had one client that came to me with sore breasts all the time, and she could not figure out what was causing her sore breasts. We looked at hormone levels, we looked at different things. Come to find out, it was actually the cream she was putting on her skin.
Wow.
Yeah, it
The
actually
cream
had
she
hidden
was
hormones in it.
putting in her skin.
Yeah.
Unbelievable. And you know, when I really started to take topical things a little more seriously is when I first got bioidenticals, and I got a clicker and I rubbed it on, right?
Yeah.
Oh, and I was like, wait, if this is changing my hormones subdermally, what else am I putting on
Yes.
that's going into my body subdermally?
Yeah.
I started looking at shampoo.
Oh, yeah. Well, and the ingredients in a lot of these products, the FDA allows 1,400 chemicals in products in the U.S. that are not allowed in Europe or Canada.
1,400 chemicals permitted by the Food and Drug Administration.
Yes. And those chemicals can affect your thyroid, can affect your adrenals, can really mess with your body chemistry.
Wow. I know that I have led people to the EWG.org, that's the Environmental Working Group.org site. And there they have a list of, gosh, so many products. Besides having the Dirty Dozen and the Clean 15 and agricultural practices, they'll have toothpaste, sunscreen, baby shampoos, and it'll have a toxicity rating.
Yeah.
And that's like, man, we could do a whole other show on skincare. But this is, I love that you said that. And also, we know that heating foods in plastics, even if it says that it's free of BPAs, well, what else are they putting it in then?
Yeah.
So let's talk a little bit about estrogen disruptors or hormone disruptors in general.
Sure. Well, I mean, you have so many things in our environment that mimic estrogens, and your receptors, they don't know the difference. They don't know the difference between the natural estrogen in your body and these mimickers in our environment, such as plastics and different chemicals that are very similar chemically to estrogen. Those bind to the receptor and stimulate the estrogen receptor, and then sometimes it's hard to get them out. And it's hard to get the good estrogen in because your body is so toxic. I had a client come to me once, and she was like, I really want to lose weight. I was like, okay, well, we need to clean up your diet. We need to clean up your lifestyle so that your body isn't full of all of these toxic chemicals. And unfortunately, I told her, you were going to have to, increase the amounts of fruits and vegetables that you eat and make sure that they're clean fruits and vegetables. And unfortunately, she just walked away and told me that, well, my family won't eat vegetables. And I don't eat very many either. And it's like, well, you have to be willing to change. Yeah. There has to be that willingness.
Willingness to change is so important. And unfortunately, when people become willing to change is when they've been handed a pretty bad diagnosis of a chronic illness, and then they'll do just about anything.
Yeah.
And as we know, prevention is key, because that is your way of doing your best. And you can only control the controllables, and one of the controllables is what you put in your shopping cart. So I met somebody who, single person, and she told me that she had a soda habit. So I said, well, do you live alone? And she said, yeah. I said, well, does someone else do your food shopping?
Yeah.
And she said, no, I do my food shopping. Well, does someone follow you around the supermarket throwing soda in your cart?
Yeah.
She said, no. I
Did,
said,
did
so
somebody else put that in your mouth?
right, you're putting that in your cart.
Yeah.
The thing that you say you can't change, you're continuing, you're stroking that.
Yeah.
So she was like, oh. I'm like, really? It's you.
Yeah. And it's a habit.
Yeah.
And you've got to start working on changing those habits. Baby steps are always good.
And I get it. You can walk into a conventional supermarket, especially around 4th of July, and you walk in, and what do you see? A pyramid of soda cans next to the potato chips, next to the cake, next to all of the other stuff, okay? There are other markets where you will walk in and the first thing you're hit with is cherries or avocado or sparkling water. And they're trying to do their best for the consumer.
Yeah.
Maybe you're going to spend a little bit more, but I'll tell you, with the impulse buying that goes on in the more conventional setting, it probably is going to balance out. And if you start to look at how many colds you're getting a year and add up the over-the-counter medications, how often is your child sick, et cetera, et cetera.
Yeah. Well, and how much do you spend on those cold products versus vitamin D?
Right.
So, yeah.
Exactly. So one of the things that I think is hard for a lot of women, you mentioned it originally when you started talking about being offered antidepressants. And I remember, this is personal stuff, but I remember I got a hot flash, and I've been an athlete my whole life. And so for me, it was a little bit later than most ladies. I think it was like 57. It's not so bad.
No.
And I went to my doctor because I wanted a referral to a lady doctor, and the first thing they offered me was an antidepressant. And I'm like, do I look depressed?
Yeah.
Was there anything about me that just...
Well, and a lot of those antidepressants have more side effects than you can count.
But I didn't even look depressed.
Yeah.
I didn't say I was depressed.
No.
I said I was sweating.
Yeah.
I said that I was getting really hot at night.
Now, there are a few antidepressants that actually will help with that, but unfortunately, the other side effects are not ones that I would want.
But I didn't want to go down that path.
Yeah, no.
I really wanted options. I wanted options.
Well, and speaking of sweating, I've had several women that come to me thinking they're starting to go through menopause, having the hot flashes at night. And when we actually look at their diet and what's going on, they're actually having low blood sugar in the middle of the night.
Wow.
And that's what's causing their sweating in the middle of the night.
So night sweats can be caused by low blood sugar, which is very easy to regulate through diet.
Yes.
And added fiber. But so that led me to reading Suzanne Summers' books.
Yeah.
I started to read her books and listening to her interviews with Dr. Mercola and Dr. Mark Hyman.
Yeah.
And I decided that I needed to try a different way. So when I went to get my first set of labs, you're going to have to really help out here. They weren't the right labs. Because when they were doing everything and I went to an expert after I got these labs, I saw Dr. Tana Richter in Westlake, California. Absolutely amazing provider, physician's assistant with a master's in endocrinology.
Nice.
And she looked at the labs and she's like, I can't do anything with these. I'm like, what's missing? She goes, your thyroid.
Yeah.
I not TSH. I want the whole thing. I want the free T3 and the T4 and all of this other stuff. And then I want a full reading on testosterone. So talk a little bit about what does a lab panel look like?
Well, let's start with thyroid. If you're not looking at a full thyroid panel of TSH, free T3, free T4, total T3, total T4, the thyroid antibodies, and reverse T3, you're not getting a full picture of what's going on with the thyroid. I get so many women whose TSH just keeps getting worse and worse. And lo and behold, when you actually get a full thyroid panel, you find out that they're not getting the nutrients to make the thyroid hormones. If you're not getting the selenium, the methionine, the iodine, you're not going to make the thyroid hormones. Thyroid and adrenals govern all of your other hormones. So we've got to get that in balance. And so you've got to look at the whole picture. When you're looking at your adrenals, you've got to look at the DHEA, the pregnenolone, all of those that relate to your adrenal glands. You've got to look at your cortisol levels. And you've got to get a good picture. Cortisol is not measured in the blood very well. It's definitely measured much better in the saliva, and taking several tests throughout the day so that you get a picture of when that person's cortisol is peaking. I get patients in that have trouble sleeping. Well, lo and behold, it's because their cortisol is peaking in the middle of the night. That's waking them up. And that's going to keep them awake for a while until it starts going back down. So you've got to get things in balance, and you've got to look at the whole picture.
So from what I understand, there's certain hormones that are diurnal.
Yes.
And this is the story. So when you wake up as the sun is rising, cortisol's coming up. And then as the sun's going down, it drops down, which triggers the melatonin cycle.
Right.
So it's kind of going like this.
But it's also affected by your body's exposure to light.
For sure. So if you're working in a basement with no windows,
Yep.
and fixed lighting, let's say you've got the tube lighting or something like that,
Yeah.
then your
Or
body
if you're
doesn't really know,
always
right?
in front of a computer screen all
blue
the
light.
time.
Mm-hmm.
Yeah.
What about shift workers?
Shift workers, basically what you have to do is work on changing their circadian rhythm to get their circadian rhythm in line with their work. So usually they have to have the light darkening shades. Usually I have to have them get a sunlight lamp just so that they can get their body's rhythm to change with the shift that they're on to get them in balance.
Yeah, it's hard.
Yeah.
It's really hard. My daughter's a nurse and she works night shift.
Yeah.
And on the days that she's off, if she wants to connect with people, she's tired.
Oh, yeah.
You know, because
Yeah.
people are awake during usually her sleep cycle.
Definitely.
So you mentioned a lot of different things, and what would be really great is, you know, when we do post the podcast in the podcast notes, if there's a link or anything to the appropriate labs, because this is important. And you also hit on something really important, that your doctor will not prescribe you most of the time something they can't read. Now, that's not saying anything negative about their practice. Is that if they haven't really studied the endocrine system, they may not know the right labs that need to be ordered for that. So what do you do in that case?
Well, it depends on the physician and the practice. You know, some doctors prefer to do blood and they'll only do blood. Other docs are more than willing to look at blood, urine, and saliva. It's just a matter of the practice, a matter of their training, and whether they're trained in endocrinology at all or not. But basically, it's a matter of how they're looking at it and what they're looking at. Are they looking at the metabolites, or are they just looking at levels? In saliva, you've got to be very careful as to what you've put in your mouth between the time you do your test and the time you don't. Things like that. So can be a lot of things that influence those levels.
And we know, like, symptomatically, you can tell, like, especially this, COVID era that we live in.
Yeah.
Symptomatically, you can tell when someone's low adrenal, when somebody's low cortisol. You can tell by, listening to their story, if they're spiking
getting
at
their
night.
symptoms.
Yeah. So I feel like people should feel a little bit at ease that if you weren't able to get the certain labs that you need for specifically like cortisol, because we can address those through herbs.
Yeah.
It's not the same as a hormone test, which needs to be compounded.
Right.
But you're not at a loss. You can find help.
Definitely.
But I do think it's really important, and let's address parents that are raising young kids, going through the stages of adolescence. What do they need to know?
They need to know that the kids are not getting educated in school about their hormones. Therefore, you need to be the resource for that. When my two boys were getting ready to go through puberty, I talked to their pediatrician and I asked her, okay, what should we use as a guide? And she recommended a book called Created by God. And that was the route that we went. And we went through, it comes with a book, a workbook, all of that. And I sat down with my boys and we worked through it. Mm-hmm. It's just a matter of be sure you're there giving them scientific information. And then also be sure that you're there for them to talk to and that they're open enough to talk to you about what's going on with their bodies, because it's a scary time for them. Mm-hmm. They don't know what's going on. Those hormones are going crazy. They're getting hair in weird places that they didn't have it before. And they need somebody to talk to help walk them through it and get them through it.
That's such great advice, because we always think about focusing in on girls and tampon usage, and this is what we talk about, and we don't discuss with these young women alternative ways, foods to eat, foods not to eat, things like that. Kids then many of them experience acne, which has a huge play on their emotions and their self-esteem and their confidence. Let's talk a little bit about, touch upon what's available to young women today. I raised 2 girls and 2 boys, and I'm not pro tampons for young women for a variety of reasons, but the chemicals that are put into the tampons, I don't even know how this passes the FDA. I don't know how this is moral or ethical. Most of them are made out of bleached
cotton, so
but it causes more bleeding.
It can. And that's why there's a lot of companies going more towards using either natural cotton, or like lately they've come out with the menstrual cups that women can use, or basically they've made products that are similar to the reusable cloth diapers that we used with the babies for women to use for their menstruation.
And here at the Center for Essential Wellness, Sarah Grant's a master herbalist, and she has a line of sea sponges.
Yep.
And it's very different because it's a different awareness, obviously. But what I really feel is that we need to think about what can we do to prevent uterine cancers? What can we do to set our young women up to have painless menstrual cycles, because the menstrual cycle does not have to be painful.
No.
That's a myth. Usually when there's a painful menstrual cycle, something isn't going as planned in the whole network of your hormones. You'll hear...
Or you've eaten something,
Right.
or you're depleted in something that your body's needing.
Many more athletic young women experience very light cycles. But I think this is really important, and unfortunately, there's a lot of medical doctors out there that are prescribing birth control pills for young women.
Yes.
Because they have painful menstrual cycles. Now, if someone came to you, so my daughter is having painful menstrual cycles, what would you do?
Well, I'd recommend that we run her hormone labs just to see where things are and to see what's going on. I would also then recommend that we actually do a nutrient blood analysis to see what nutrients she might be deficient in. Those two things, once you get those two things in balance, usually covers the majority of things going on.
You are so speaking my language. So much, because blood doesn't lie.
No.
And why we're not doing more blood work, I don't know. And, you know how to read the blood work?
Yes.
Right. So you can get the labs. Now, let's say someone can't get it through their doctor, so they're not going to your standard labs that, Quest and LabCorp. I have seen labs like Everlywell and other things online that somebody can order from.
Yeah, there's lots of even LabCorp now has it where you can go online and order your own labs.
Really?
Yes.
It's like you don't need a prescription?
No. And then there's like Ulta lab tests now, Ulta lab tests. I mean, there's lots of different companies out there that will allow you to order your own labs now.
This is taking your health into your own hands.
Yeah.
So this really excites me, because I didn't know this till just now. And for 5 years, I interpreted labs. I had a very big corporate nutrition job. I was the nutrition manager, and we ran labs. We did food sensitivity labs. We did a whole CBC panel. We did cortisol. We did a hormone panel, which included the thyroid, obviously, because it's a hormone.
I work with a company called Rupa Health that basically has packaged up a lot of the functional medicine lab tests. And so then the docs can go through them and basically order the lab tests for the patient. And then Rupa takes care of working with the patient on their insurance, working with them on their HSA, things like that. And then the doctor just waits for the results back after Rupa's worked with the patient. So
this is great. And
them.
HSA and FA.
HSA?
Yeah, it's also, so you have the HSA and the FHA, is it? Anyway, those are your flex spending accounts. That's a FSA, right? Yeah. So what this is if you work for a company, you can get your flex spending account is money taken out pre-tax dollars that you can put aside for medical. It covers a lot of over-the-counter things, contact lenses, things like that, but it'll also cover these labs. Mm-hmm. These labs aren't cheap. They're not out of reach either.
No.
And they're worth it. It's so important. Vitamin D, for instance, so many people are low in vitamin D. Yes. And here's an interesting thing. So when I had this corporate job, I'm a nutritionist. I take my vitamins. I was taking the right D, the right kind. Mm-hmm. And when I got COVID the first time in 2020, I just take my vitamin D levels. They were so low.
Yeah.
They were so low. So I was thinking, why was I not metabolizing it?
Well, it could have been that you're not absorbing it.
Right.
If there's inflammation in the GI tract, you're going to have trouble absorbing the nutrients that you're taking in. Therefore, things like liposomal products become vital, because then you squirt it in your mouth and that starts being absorbed right away in your mouth. Therefore, you're not having to worry about it trying to cross through the GI tract that might be all inflamed.
So the liposomal vitamins are vitamins that are carried with a fat.
Yes.
That's awesome.
Yeah, usually with lecithin, as usually sunflower lecithin is usually one of the carriers.
That's great.
So, yeah.
What a great piece of information. There's so much stuff. So if I were listening to this and I didn't know the world that we live in, you and I, and this stuff's like stuff we study, but it could be very confusing for the consumer. So if you're listening to this and you're like, your head's spinning, I hear you. And that's why you need to connect with a professional like the Herb Doc, who probably has a phenomenal network of this is what you need, these are the labs you need, and you have insurance or don't have insurance. She's probably dealt with all of that, knows like how to help you navigate through it. Nutritionally, I can take those labs that you have and turn them into food on your plate.
Right.
So if I see someone that's got Hashimoto's or different types of things, or has an estrogen receptor dominant cancer, I know how to write that meal plan, which is so ambiguous for people because, okay, now what do I do?
Yeah.
So how do people get a hold of you? And I know that I'm going to see you for sure. And I would love to do like before and after labs and maybe even post it so that,
that would be great.
I can then document my journey. I think it's really important. But let's tell everybody how they reach you.
Sure. I'm theherbdoc.com. That's TheHerbDoc.com. You can also reach me at theherbdoctor@yahoo.com. Or you can reach me by phone at 719-930-1829.
And do you help people only in Colorado or nationally?
No, nationally, and actually I do have a few international patients as well.
Great.
So, yeah.
So doesn't matter where you live, you can access this wonderful woman who's got so much knowledge, male, female, parents. You heard what we said about kids going through adolescence. Let's support them. Let's help them.
Yes.
And today we're transmitting from the Center for Essential Wellness. It's a fabulous place with all kinds of alternative practitioners. Today's episode is sponsored by Essential Wellness Society and Healing Well Holistic and Healing Well Retreats. Thank you so much for tuning in today, and I'm sure you're going to have lots of questions. Hit us up for it, and we'll answer them to the best that we can. Thank you so much.
Thank you.